Hi, welcome back to my channel. In this video, I'll be covering the cells that are mentioned in the synopsis for oral pathology. So first of all, we'll just look through the cells, and like you don't have to remember like the specific cells that you have to remember. I'll be telling them along with the condition they're found in, but you don't need to remember them like specifically like this looks like this looks like this. This is just for pictographic memory so that we remember to what name does the disease in the cell belong to. Okay, so starting from the first one. So yeah, so see this first one. So these are called as Downey cells. Okay, just give me a second. My pencil is not connected. Yeah, so first of all, you should know where a Downey cell is seen. So Downey cells are seen in a condition which is infectious mononucleosis. Alright, so yeah, so starting from the first one. So this is our first, and it is Downey cells, and they are present in infectious mononucleosis. Now you should know the other names also. So one name is glandular fever and another name is Kissing's disease. All right, and Kissing's lesion is different. It is median rhomboid glossitis because the lesion occurs on the tongue, and then it also, when it touches the palate, then there also it occurs, so that is why it's called as Kissing lesion. All right, so now look at this. This is quite evident. This is our racket cell. Now R for racket, R for rhabdomyosarcoma. Now this is a tumor of striated muscles. All right, now there is one more name for it, which is the ribbon cell. So you can also call it ribbon cell. All right, and they are nothing but modified. So I'll write it, modified spindle cell. Okay, I should write it with black, I guess. So modified spindle cell. All right, now let's go through the third one. Now this is a tough one to crack, but these are just some benign dyskeratotic cells. Now for this you have to remember dyskeratosis follicularis. Now if you remember, this is related to the trifecta of corpse, rods and grains. Okay, now let's talk about next one. So in this, by looking at the target cell, you should be reminded of two conditions. One is thalassemia and one is in our oral path, but that is a target lesion. Okay, this is a target cell. Fine. So in thalassemia, you see target cells plus these also they have safety pin cells. Okay, these are nothing but normoblasts. Okay, now coming on to the next one. Now these are like very pretty cells, right? So this is the plasma cytoid cells, or if you think about it, these are the hyaline cells. Okay, yeah, first you can remember plasmacytoid cells, and then these are the hyaline cells. So these are present in pleomorphic adenoma, and they are modified myoepithelial cells. Okay, now coming on to the next one. Now this is something that you need to know, that this is a very characteristic appearance, right? So these are anti-Schau cells. Now this is basically going to look like a caterpillar if you look at it, so you can remember it as caterpillar like cells. Now these are present in a number of conditions. First of all, you should remember is the aphthous ulcer, then sickle cell disease, then you should remember iron deficiency anemia and rheumatic heart disease. So these are modified epithelial cells. They have an elongated nuclei with, and there is this linear bar of chromatin, and you can see the radiating like this, right? So these are the radiating processes of chromatin. Okay, now let's look at the next cell. Now this cell is the Zhang cell. Now you should know Zhang cell, where it is present. So it is present in pemphigus, It is also seen in herpes. Okay, these are multi-nucleated giant cells of epithelial origin. Okay, now coming on to the next one. So this is our Arbiscove cells. So these are, if you look at it closely, these are modified monocytes, right? And these are seen in, for this just remember the name of the pathology, so myeloblastoma. All right, now let's talk about these cells. So these cells, now we are on ninth. So these are characteristic ghost cells. Now this is important. Now you should know all the conditions in which you see ghost cells. So if you look at it, these are basically epithelial cells with eosinophilic cytoplasm without nucleus, right? So these are seen in, first is COC, that is Gorlin cyst. Then second is myeloblastic fibroodontoma, then odontoma, and then there is one tumor of the pituitary or the Rathke's pouch, which is craniopharyngioma. Okay, so this is our Rathke's pouch tumor. Okay, now we have 10th. Now this basically are nothing but angulate cells. Now these angulate cells are seen in, just remember the name, no need to remember the picture, like it's not that important for us. So myoblastoma. Okay, then coming on to this picture, now wait, first we'll do these ones. So look at this and look at this. So both are clear cells. Okay, now this is glycogen free and this is glycogen rich. Okay, yeah, maybe just remember the conditions. Okay, so glycogen rich ones are the one as LPC and gingival cyst of adult, and glycogen free are acyanic cell carcinoma and mucoepidermoid carcinoma. Okay, now coming on to this, first of all we have to look at one more thing which I forgot. Yeah, this one. So these are our LE cell. Now what is LE cell? It is a rosette of neutrophils which surrounds a pale nuclear mass. Okay, wait, this is LE cell. No, yeah, this is LE cell, which is basically lepra cell. Oh sorry, this is SLE. Yeah, so this is SLE, seen in SLE. Fine. Now let's go to the next. Now these are our gargoyle cells. Okay, this you need to remember where it is seen. It is seen in Hurler syndrome. Now this is something which is new, which is parasite of Zimmer. Now Zimmerman. So this is seen in glomus tumor. Okay, now you just need to know where it's present, but I added a photo so that you remember. Now look at this. This is our owl-like appearance, and this is the Reed-Sternberg cell. It is also called as Dorothy Reed cell. It is nothing but modified B lymphocyte or a macrophage monocyte derivative. Now you should know where it is present. It is seen in Hodgkin's lymphoma. Okay, now let's go through another variety. Now this is a lacunar cell and it is seen in the nodular sclerosis type of Hodgkin lymphoma. Okay, now look at this characteristic appearance. Now this is our Taunton giant cell. Okay, this is a multinucleated cell. So this is seen in fibrous histiocytoma. Okay, Now look at this. This is characteristic. Just look at the picture. Just remember, okay, like what I'm talking about. So like you just have to know pale cells and dark cells. Now these are seen in odontogenic myxoma. I just added the picture so you remember the description. Now this plasma cell, Gaucher cells. So these are our Gaucher cells. Now in this you have a eccentrically placed nucleus. Now here one characteristic is these cells have the appearance of crumpled silk cytoplasm. Gaucher cells seen in Gaucher disease. Okay. Now look at these cells. These are looking as lipid laden cells. So this can be anything, but specifically it is the Niemann Pick cells. Okay, not Niemann. So if you remember, it is due to deficiency of sphingomyelinases. Okay, fine. Now look at this. This is the foam cell. Now foam cell should remind you of all the conditions like atherosclerosis, right? Then you can also, but here specifically you should remember periapical granuloma. Okay, and these are foam cells. Okay, now let's go through this one. Now this is a characteristic stain which is called as the Papini-Coelho stain. Now this stain is specifically used to stain coelocytes. Okay, now these are nothing but the HPV altered epithelial cells with perinuclear clear spaces, with perinuclear clear spaces and nuclear pycnosis. Now next photograph, I want you to remember the type where it is present. See, these are our popcorns. So this is a popcorn cell. See, they look like popcorns, right? So popcorn cell. Now this is present in the lymphocyte predominant. Now if you remember, lacunar was in nodular necrosis. Okay, sclerosis. See, if you forget. So yeah, okay. See, P for popcorn, P for predominant. Okay, that's how you're going to remember it. So predominant. Okay, of Hodgkin lymphoma, predominant type. Now look at this. Now this is something which I added with the labeling so that specifically you know. So these are basically to indicate centrocytes and centroblast. So this is present in the follicular type of non-Hodgkin lymphoma. Okay, yeah. So I think I've covered most of it. Yes. So this basically completes the table that is given for different cells in oral pathology. If you found this video helpful, to give it a like, and I think I discussed around cells. So the most asked is plasmacytoid cells, owl-like eye cells, Hodgkin lymphoma, right? And yeah. So this completes most of the things that you need to know about it. So if you found this video helpful, do give it a like, share, subscribe. Thanks for watching.